There we go. Welcome to another edition of Show Up Central Oregon. I was unmuting myself there. As is always my pleasure on Tuesdays and Fridays, I am excited to welcome Cheri Helt. Cheri, how are you today? How are things for you?
I'm good. It's really exciting to be here. Did you say Tuesday
No, I said
or Friday?
Tuesdays and Fridays. I said as
Okay.
always on Tuesdays and Fridays, but it
Okay.
was it was actually Wednesday and Friday this week. So yes, but
It
yes,
gave me a pause. I was like, is it Tuesday? I thought it was Friday.
it's any day ending in Y. That's what it is, Cheri, as we
Yeah.
know. I wanted to start out since Tuesday, since we talked on Tuesday. I wanted to talk about or Wednesday. We talked about Wednesday. I want to talk about CARES 3.5. Obviously, has passed the House now. It had passed Senate. Now it's passed the House. So what does that look like for Oregon? And I realized that yeah. So what does that look like for Oregon at this point in time? And that's going to be opening up obviously some PPP funds and some of the other things.
Well, thanks for having me today, Matt. I always appreciate and look forward to our time together. So the CARES Act 3.5 is going to have $3.10 billion that will go into the PPP loans. Those loans were depleted. The other 350 billion were depleted in 11 days. So that was quite fast. And so this will give much needed relief to employees and employers who are still struggling and were not able to get funds. It also will have $50 billion to go into the EIDL loans, which were the SBA loans that were also ran out of money and were not funded.
Mm-hmm.
And so completely. And so we have those that are ready to go. And I think my dog is going to bark. So I'm just warning you all
It's okay.
uh, that one of my many hats, dog owner.
Yes.
And then $10 billion for the EIDL loans for the advance and grant program as well. And so if you remember, there was a little line on the EIDL loans that business owners could sign up for an immediate advance.
Mm-hmm.
And that will have the $10 billion going into that. $75 billion will go into hospitals and healthcare providers. And I believe that that is one of the things that people are not really aware of as much as they are struggling. Hospitals have really struggled to be able to afford to stay open while their revenue streams of surgery and emergency room departments have declined tremendously or been shut off,
Mm-hmm.
depending on access and requirements. And so that $75 billion will really help stabilize a lot of hospitals across our nation. And the interesting part about it is in a pandemic, you don't think of a hospital as being, not funded, but
Mm-hmm.
it really is because of the way the revenue comes in and the amount of staff that we've asked hospitals to keep on and manage our surge. So this is really, really an important thing and very important, especially in Central Oregon and rural Oregon, because we need to make sure that our hospitals are stabilized and we're able to get care through the pandemic by making sure that our hospitals are able to keep their doors open and provide us care. So not only are they the frontline workers putting their lives on the line, but their jobs are also on the line due to lack of funding. And so this $75 billion from the CARES 3.5 is going to be imperative to keeping our hospitals open and keeping our communities safe.
Mm-hmm.
And so then we have the $25 billion that the federal government is putting into testing, which is going to be really imperative as we open up. We know we're going to need more testing and more reliable testing. And so this is going to be a really, really important piece as we continue through. We all know that we've not had enough testing the entire time that we have been in this pandemic due to the fact that people are creating the tests as we are going through it. So now with this $25 billion, they will be able to invest in testing that will be able to be utilized across our nation and in our state.
Mm-hmm. Yeah.
Then in the CARES Act, we also have that $1,200 per person, $2,400 per couple, and $500 per child. This is a really, really important revenue stream for a lot of our folks who've been having trouble getting unemployment insurance, and it has helped people get through the crisis to be able to pay rent and get food on their table. And so, if you are a veteran, your benefits are going to be directly deposited into your account because they have access to knowing what account they normally put money in. So the
Right.
federal government went ahead and did that. I think I sent you something ahead on
Yeah,
that
you
so that
did.
the veterans are, going to be getting that money. And if you're not, and you're a veteran, please reach out so that we can help you figure out what happened.
And that's a question, Sherry, I have. Is this is an additional, or is this something that is the same? Only they've just now said, we're gonna make sure that it gets there.
No, this is the same.
Okay.
It's the same fund that we've been talking about. So a lot of people have received these funds already, but some still haven't. And if you haven't, there is some websites that you can go on to figure out how and why you haven't. And also, if you're a veteran, you should have directly received it.
Okay. Great. Great. Yeah, and I know that just a general reminder for those people that may not have received it, if so, what everything, and correct me if I'm wrong, Sherry, but if you have not filed your taxes over the last 2 years, they don't have any information for you, or if they have no information, then you may be getting a paper check, which is going to take a little bit longer. Is that accurate, Sherry?
Yeah, so there is a website where you can reach out to, and we can put that up, or I can put that up on my Facebook page for everybody. If you have not received a check and you haven't filed taxes, you can let them know where you want them to send your check or deposit it. So there's a way to let them know. And if you choose not to do that, then they're going to send you the paper check, which is going to take longer, unfortunately.
Yeah, absolutely. I wanted to get into our numbers as far as the state of Oregon before we've got some other good news too to share. But state of Oregon, we're doing well, correct? I mean, as far as our numbers have obviously plateaued, we're kind of going the right direction at this point in time. Can you kind of give us a kind of a state of where those look like at this point in time, Sherry?
Yeah, we're still waiting for those numbers that we talked about on Wednesday that are going to say the amount of people who have recovered. So we don't have the recovery numbers, but we do know there are a lot of the people that have been diagnosed have recovered. So 2,177 positive cases. And we now have crossed a threshold of 43,315 negative tests. So that puts us in about the 5% range of positive tests. And so we know that we've plateaued, and that's a good thing. And then, unfortunately, when we listen to these numbers, I hope that everyone out there thinks about them as your neighbor, your neighbor's parents,
Yeah.
your friends, colleagues. But we have lost, unfortunately, 86 lives in the state of Oregon through this COVID crisis. And that's a really sad number and very unfortunate. But that's where the numbers stand from a state level today. And then from our local level, we have 44 positive cases that have come out of St. Charles. We have one inpatient currently, which is up from 0 earlier this week.
Yeah.
And then we have 73 positive cases in Deschutes County, and that is out of 1,294 tests, and then 105 pending tests. So now if you think about in Central Oregon, we've had 1,294 tests out of St. Charles. We still need to ramp up that testing, but we do have the infrastructure in place now to have more testing. We have the drive-through testing that is available at St. Charles, and you call up and you make an appointment and you come in and you don't have to get out of your car. It's the safest way for you to be tested, as well as the safest way for our first responders. And so that is really, really important. And then, as we continue to get better testing, we will be able to ramp those numbers up more quickly. And that's one of the things about reopening is making sure we have adequate testing.
Yeah. And we are so yeah. Central Oregon, obviously, with what's going on at St. Charles, they just was it last week, Cheri, that they opened that drive through testing? Was that accurate? I think that was
Yeah,
when we talked
last
about it.
Thursday. So I think it's been open for a little, 1 week and 1 day now.
Okay, great. So that and again, that's doctor. You have to have a doctor's prescription, or I'm not sure exactly, doctor's note to do that. So that is great that we're starting to do some testing on a regular basis now. Um, I know that Monday we were supposed to have some sort of portal for unemployment, and I'm just, I keep getting asked by some of my, my 1099 friends and some of these, and I know this has been you've been pushing hard to figure out what this is. What is the current information at this point in time that you can share to everybody that obviously
Yeah.
probably is frustrated?
So my heart goes out to everybody that's waiting for the PUA, which is the Pandemic Unemployment Assistance Program. Um, in the unemployment department, we all know now that we're working with really antiquated software and computers, and so this takes an incredible amount of programming from the unemployment department. And since this is a completely new program that we have never put into place for independent contractors, it has taken a very long time to get the software programmed, and they're hoping to have that by the middle of next week, is what I'm told, so that you can apply. Um, that is just so hard. I'm so sorry that everyone's out there struggling, and please contact me if you need rental assistance or food assistance or whatever I can do to help you and your families while you wait for this program to be
Mhm.
um, put in place. But that program will then allow independent contractors, so, hair salon, plumbers, electricians, if you own your own businesses, to be able to apply for the $600 a week from the federal government. So that is continuing. They have it now in a testing phase, and they believe it'll be ready next week. As soon as that is ready, I will let you know. And I know I've had a lot of people reach out to me, and it just breaks my heart that we don't have that. I can't bring a better solution quicker. But it will be looking like the applications will come next week. It's anticipated that this could be as many as 100,000 people that are applying for this program that are
Wow.
waiting. And that's what gives me a lot of pause and a lot of heartache, and makes me wake up at 5 o'clock in the morning trying to figure out some more solutions. But the reality is that it will be next, the middle of next week is what we're anticipating. And fingers crossed, and that we get there to be able to apply for these pandemic unemployment assistance. So it will be coming the middle of next week. And remember that you will be getting back pay. So that will be very helpful for those families that are really waiting
Hmm.
and, and struggling.
Right. Yeah. So hopefully, middle of next week is kind of what I'm hearing you say at this point in time.
Mm-hmm.
Okay. And I'm gonna then jump to some good positive news. I know you were lobbying heavily to open the hospitals for
Mm-hmm.
elective surgery, and the governor yesterday morning actually said, "I think this is a good idea." And she lifted that part of her order. Thank you for doing that, obviously, and pushing for that. I mean, what is that going to mean for these rural hospitals and all these people, sort of, that are just out there and it had to gear up for pandemics, but obviously they couldn't produce some of the other revenue generating things.
Yeah, so I want to thank the governor for lifting that restriction as of May 1st, and really allowing. May 1st is going to be really a great timeline, because you can't just walk in and get surgery that is elective surgery to be scheduled. So you've got to have the testing procedures to make sure that you don't have COVID, and that your heart's in good shape, and that you're able to do the surgery. So this timeline, if you have been waiting for elective surgery, now is the timeline to contact your surgical provider, your doctor. or your clinic to let them know that you want to get put on that list, because there is a backlog of people that have been waiting for these procedures. And we now have criteria of what that means. And the governor made a really wise choice with her medical advisory panel, I believe is what they're calling that group, medical advisory group or panel. They are now returning the autonomy back to the medical providers to be able to monitor their PPE supply and make sure that they have enough PPE supply and that they have enough testing supply, and the tests are returned within 2 to 3 days, and then they're able to do those procedures. And we call them elective, but really they're not what I would have considered elective before we started this process.
Mm-hmm.
If you've slipped a disc and you're in pain, a lot of people are just really taking a lot of pain meds that they are having unintended consequences from, not being able to get up and move around, which also create unintended consequences. And getting these surgeries done will bring necessary relief to our, members of our community, as well as those hospitals that need some income, and our surgery centers, and getting some of our employees in our surgery centers and hospitals back to work. And so this is going to be the first step to reopening our economy. And I think it's the best place to start because, one, the need is great and the consequences are also great. We've been hearing from a lot of people in the community who are having consequences from not having their surgeries that they need to get done, or just not reaching out for care. A lot of people just are really uncomfortable going to the hospital because they're worried that they will contract COVID. And so our hospitals have different teams in place and really strict, stringent sanitation protocols to make sure. And this is what doctors and healthcare workers and nurses do, is prevent the spread of disease. So it's important that if we're going to reopen something, we do it where people are really versed in making sure that this doesn't cause spread in the disease. So this means that they have the ability to do this if they have the resources to do it. And so that's an important stipulation as we look at opening, our economy back up and moving towards some more normalcy. This is really a first step that is really important to the stability of our hospitals and the stability of our community members.
Mm-hmm. Yeah, absolutely. I think it's going to be great for, all of those rural hospitals and everything that they couldn't. And like you said, I think it was last week when we were talking about this. They're the people that get this the most. They're the ones that don't want to spread this. They're the ones that they know. So it's like it makes a lot of sense that they're going to be the ones to reopen and be doing those elective surgeries for sure.
Yeah.
I have a question in regards to where we are timing and so for those that have not watched the governor's sort of press conferences, can you sort of give us a sort of a layout of kind of the plan, or what sort of are you getting a sense of at this point in time for how Oregon is going to sort of look to reopen the state at this point in time?
Yeah, so I think this is a really critical point. We have to make sure that we get this right, because we want to honor the work that everybody has done and all the sacrifices that everybody has made. Everyone has stayed home, flattened the curve, and saved lives. And so now we need, there's the bark. I told you there was going to be a bark. And now what we need to do is responsibly open up our economy, but do it in a way that doesn't reverse the work that we've already done. And so we want to make sure that we put in place really thoughtful restrictions, and yet, allowing people to get back to life as normal. And defining what our new normal is going to be for a little bit is going to be really important. And so right now the governor is putting together groups of industry folks and trying to get information on what they think they need to do this safely and effectively. And I think you'll be hearing about that in the next week. It looks like May 4th is one of the first deadlines where they want the information back from these groups. So we'll see what that looks like.
Mm-hmm. Yeah. So another final question, Cheri. What's on your agenda? What are you looking at right now that you're like, okay, this is sort of, obviously you were looking at the, pushing the governor to open up hospitals. What's kind of on your heart and mind at this point in time that you want to share with people that, you're super concerned about right now?
Well, I'm working on grades. I think grades are really important for our K-12 folks. I think that we've worked really hard to make sure that we have a system of education that is competitive for our students and equitable. And I want to make sure that we're considering getting grades for our high school students, because as they transfer and move on to college, their grade point averages are going to matter. And a lot of school systems across our nation have still kept grades. And so I want to see if there's a possibility in a way that we can get grades back implemented if students choose to do so.
Mm-hmm.
Or we could also look at what LA Unified School District did, which was to not take away grading, but use it as a positive. So you wouldn't go down from your grade that you had the day that you left the brick and mortar school, but you could improve your grade. And so I think that one of the things that really motivates kids is feedback, and feedback from teachers is the best predictor of success.
Mm-hmm.
The best predictor of success, regardless of all the new fancy tests we make and all of these hoops that we try and make everyone jump through, is actually the grades that your teacher gives you. Because they're steeped in the pedagogy of making sure that you're successful. And this is what they do. And so it gives me a lot of pause and heartache to think that the kids are not getting the grades that the teachers are, have worked so hard on to make sure that they have the feedback. And without that, I don't know how much of an incentive there are for kids to continue to learn for some children. And also, I want to make sure that they're able to get into the colleges of their choice when they get there. But
Mm-hmm.
if we don't give them those grades, I think we're missing a real opportunity to incentivize our students and give them the knowledge and feedback from their teachers who work so hard to give them their lessons.
So it's funny you should say that, because I am doing a show with Combat COVID-19 Central Oregon, and it's called Quarantine, which is basically three teens talking about what it's been like to be in this. And that topic actually came up by one of the students. Actually, she was very concerned about the fact that exactly what you said, how her grade point average will not carry forward because it's not there. So I appreciate that, and I think it's also important to mention, Cheri, that it's not like this is something that you are concerned about from a state level. I mean, you are concerned about it, but you do have some background by serving on the Benland Pine School Board and some of the other things that, some of this comes from, some service to the community. And I definitely appreciate that view as well. So thank you.
I also sit on the state school board as Bev Clarno, our Secretary of State's designee. And so I have been advocating at the last state school board meeting about this.
Great. I was not aware of that. Thank you. Thank you for doing that. I appreciate that. That's one more thing to add to your have to do list, I guess, basically.
Well, before that, I was a recovering school board member, so it made me feel much better to be on a school board.
Oh, that's true.
I really enjoy my school board meetings for the last 8 years.
That's great. Anything else, Cheri, you want to leave us, remind us before we get into the weekend?
No, I just want to remind people to stay home and stay safe and make sure we're saving lives and just continue with what we're doing, because I think the important part about the talk about opening up is that we do follow the guidelines, and we do it very slowly so that we do not undo the work that we have done. And so keep that in mind as the weather warms up, and make sure you're social distancing. And I think one of the things that we all should be looking towards is trying to find a source for masks that will not take away from our first responders, but maybe the handmade masks that are cloth that wouldn't be able to be used in our doctor's offices
Hmm.
and our emergency rooms, but will keep us from spreading the disease when we're out in the community and social distancing safely.
Yeah, and there are some great people I know here locally doing that, making those handmade. In fact, also we have Blackstrap, who kind of has pivoted. For some reason, I hate that word, but pivoted in this time to making. They call them the Civi mask, and so those are actually local company. It's shipping out of here. They're made here in the U.S., and so yeah, it's just been great to see that. So, yeah, thank you so much, Cheri, for joining me. I appreciate it,
Thanks
as
for
always.
having me, Matt.
Yeah, and get some rest. Find some downtime. Just don't work yourself to death. We need you where you are at. So we appreciate you, and don't work yourself too hard. So thank you again.
Once everybody's done with this and they're out and socializing, I think I might hibernate for a little bit.
Well, good. You deserve it. That's for sure. Thank you, Cheri. I appreciate
Thanks,
it very
Matt.
much. Yeah. See you next week for sure.
Okay.
All right. Sounds
Have a
good.
great weekend.
Yeah. You too, Cheri. Thanks. All right. That was Cheri Helt. Obviously joining me on Tuesdays and Fridays. So here on Show Up Central Oregon, another edition, Show Up Central Oregon. I appreciate all of you guys joining me. It's obviously this is a labor of love for me. I so love doing this. I love connecting people. I've got some great interviews next week. My normal Cheri Helt, and also Tom Schnell. We have a Opportunity Knox interview next week, as well as we also have I'm really been concerned about how we can better care for the caregivers at St. Charles. And I've got somebody that's going to share some ideas and thoughts for us. So, yeah. So, thanks. Have a great weekend, whatever you're doing. Do stay home. Try to be, I said in my morning minute this morning, maybe avoid the social distance, but the personal distance is extremely important. We all need to be socially connecting, whether that's phone, Zoom, but not in person. So please do that. And again, on behalf of myself, I want you to all show up for Central Oregon.